Bismillahirrahmanirrahim. Assalamualaikum and hi everyone. My name is Kufrizan Binti Kubut and my supervisor is Professor Dr. Nur Zaidi and Professor Madhya is Dr. Sabaina. So today I would like to share my concept paper with the title of Determining the Relationship Between Food Service Information System Usage and End User Satisfaction in Selected Malaysian Public Hospital. So this is my presentation outline. I will begin with research background, significance of study, literature review, methodology, and I will end my presentation with conclusions. So, various hospitals across Australia, United States, South Korea, Singapore, including Malaysia, has witnessed a significant transformation in the implementation of information system in the various healthcare divisions such as nursing, medical records, pharmacy, including hospital food service to contribute to the patient's care, which can enhance good practice that can enable and achieve organization objectives. So briefly about food service information system history in Malaysia. FIS was first developed to improve conventional meal ordering procedures, especially the obsolete manual ordering of patients' food, to ensure that technology is in line with other developed countries other than to reap the benefit regarding health information system usage. Malaysian Public Hospital or MPH started an electronic system called Sistem Pengurusan Pesakit in 1994, as mentioned in IMOH 2019, which the focus will be on the computerized order entry and result management, where the FIS is developed with the intelligent integrated system to help the information system. But now the implementation had much improvement, especially when the system is implemented in conjunction with newly developed hospitals in Malaysia. So the relevance of hospital food service and food as medicine according to the Serio VA 2019 is not a new concept and can be linked back to one of the earliest medical works. Furthermore, food service has become a significant concern in hospital settings because 75% of hospitalized patients depend solely on hospital meals for their nutrition. Therefore, food service information system is used with the advantages to keep diary records of patients, in division management, decision support, and workflow process. So in health organizations such as hospital food service, the implementation of FIS are inevitable due to many mediating and dominating factors such as organization, people, and technology. Although the system has been implemented for a long time, the data obtained is usually questioned and end users have difficulty at the level of data processing to be used for organizations' decision making. When this happens, it clearly shows that the implementation of the system is imperfect and cause a waste of money that the government has granted. While its information system is implemented to benefit organizations, therefore monitoring and evaluation of the system's effectiveness should be carried out periodically so that problems and obstacles in the system can be immediately known and resolved, as suggested by Bilonda 2 et al. 2020. So the need to study the information system used in MPH is in line with the Ministry of Health, Information Communication and Technology Strategic Plan, where a detailed study is needed to achieve the MOH mission to optimize comprehensive IT services for more efficient and effective health service delivery, as mentioned in KKM 2016 and Ministry of Health 2019. While assisting the policy maker is constructing the health information system to produce the model of good and patient care, it's important to know that information system is vital in the organizations and end user satisfaction is almost used in IS study to determine system usage effectiveness. The study will disclose the influence of FIS usage among end users who are classified as practitioners in hospital food service in Malaysia's public hospital to enhance the service. It's a good phase for the government to identify the factors contributing to the FIS usage efficiency in public hospital while improving investment return. The study provides empirical data on FIS usage in hospital food service industry, which the scarcity of IS success in hospital food service has not been tackled before. So the study results and findings aim to provide valuable new knowledge and information and encouraging future research in this area. So, as researchers have focused their efforts on constructing and testing models that can help anticipate system use, system success, and the user factors since the middle 1980s. So, as a result, a variety of studies on the use of information system and their effects on end users have emerged. So, the most commonly used models are information system success model by Dillon and McLean and technology acceptance models by Davis et al. So these theories develop with different purpose or perspectives. So the focus and outcomes are very different. The combination of this existing IS model is not new since a few prior models were merged to present a holistic and comprehensive model to test the success of IS. So in comparison to the IS model, the combination of the model is needed to be employed as a theoretical framework for this research. So after the review of these underpinning theories as stated in this table, the integrated model of the updated ISSM and TAM, such as system quality, information quality, service quality, and perceived usefulness will be chosen as main variables in the new proposed model to determine the relationship between FI association and user satisfaction. So the literature review carried out various factors related to user satisfaction with I association in hospital. The research attempted to discover FISUs within the application of the adoption of EAM models and ISSM in establishing this theoretical framework. So this study permitted to identify the significant variables input whereby the updated ISSM address variables such as system quality, information quality, and service quality, whereas TAM address one related variable which is perceived usefulness and linked with FI association and user satisfaction. So in the study, the independent variables, information quality, system quality, service quality, and perceived usefulness. So this framework demonstrates the relationship between the four primary determinants to FI association and user satisfaction. So this theoretical merging has been taken from the variation of output relevant to develop a conceptual framework. So the key concepts and relevant theories tested by previous scholar will be the pillars and research sources. So therefore, in this research, 9 hypotheses have been defined to be tested for a positive influence to determine the relationship between FI association and user satisfaction in selected mission public hospital as depicted in this table, and conceptual framework has been proposed accordingly. So this table summarizes recent studies on hospital food service in various countries such as United States, Australia, Thailand, Indonesia, and Malaysia. So the study is on different concepts whereby scholars propose to develop a new system serving diet error and hospital food service sustainability. And the literature shows that there are limited studies on hospital food service regarding information system usage and end user satisfaction. Therefore, it is a need to have a new scholar to investigate another concept of study in hospital food service, such as the relationship between FI association and user satisfaction, particularly in mission public hospital. So this figure indicated past study on IS implementation in different hospital divisions. So this previous research has focused on similar issues such as IS quality, user acceptance, and satisfaction. So most earlier study on IS usage in hospitals have concentrated on clinical, hospital management division rather than covering other support service in healthcare such as food service. So as a result, a study in hospital food service is required to determine whether there is a relationship between FI association and user satisfaction, as food service division should not be neglected as it has the function of aiding the care of the patients as mentioned by Barrington et al. 2018. So the study will employ a quantitative approach with a questionnaire survey method in data collection. So respondents will be selected among end users of FIS as a unit of analysis using probability sampling, because the goal of the study is to generalize the findings to other MPH, and the number of end users to be included in each hospital will work out size sampling based on the staffing level of the respective facilities. So a selection of 6 MPH in the Klang Valley area will be chosen from a population of 35 HIS or PHIS public hospitals in Malaysia, consists of 358 subjects. So as a conclusion, this study has the potential to add new knowledge to the literature about certain factors that may influence the end user satisfaction with FI association in selected public hospital in Malaysia. So apart from that, the study findings are expected to provide information to the hospital food service industry on FI association effectiveness that may affect end user satisfaction that can be used in future studies implementation of FIS in MPH. So furthermore, the study is expected to show the relationship amongst those factors in the context of FI association, and by combining popular influential model, the validations model through the findings of the study hopefully will help improvement to Ministry of Health towards achieving the mission of enhancing technology implementation in the MPH service divisions. So organizations that successfully adapt to the use of information system will successfully increase productivity, and it is measured by efficient and satisfied employees with the technology provided. So this is our reference I use for this presentation, and thank you for listening. Assalamualaikum.